Hello, everybody. Welcome to this week's episode of the One Thing Podcast. I'm your host, Dr. Adam Rindy. Over the last 25 years, I've seen so many different suggestions related to weight management, ranging from low-fat diets all the way to carnivore diets, to intermittent fasting, caloric restriction, keto, high protein, you name it. But one topic that I really think is important, regardless of the diet, is the ability to avoid self-sabotage. This is when willpower is no longer working and some of our greatest intentions seem to undo themselves. When I was researching this topic, I came across Dr. Helen McCarthy, a clinical psychologist with over 20 years helping people recover from trauma and eating disorders. She's discovered something that psychology seems to have missed. This is what she calls the appetite pendulum, a simple way to understand hunger and fullness, and developed tools like the pause technique and the 4 saboteurs framework. These tools are not gimmicks. They are practical, evidence-based strategies that can help you retrain your brain around food. Today, we'll unpack why evenings are so dangerous for overeating, how to tell hunger from emotion in the body, and how a 10-second pause can change your relationship with food. By the end of this conversation, you'll have a framework to reduce late-night snacking without a war of willpower. I hope you enjoy this episode and find it valuable. So without further ado, welcome to the next episode of the One Thing Podcast. Dr. McCarthy, welcome to the One Thing Podcast. It's a delight to be here with you today.
Thank you, Adam. It's a pleasure to be here.
Yeah, so I'm very excited to speak with you today. As we were talking before, we've covered this topic at different ways on this podcast, but really sought out your expertise and wanted to invite you on the podcast because of your ability to be really comprehensive in your approach, both from sort of a biochemical, medical perspective and then a psycho-emotional perspective, and just really was hard for me to find someone that balanced things as well as you did. So thank you for agreeing to be on here, and look forward to diving into things with you today.
Lovely. Thank you.
I think just as a starting point, it would be great to hear your moment when you learned or sort of embraced the fact that metabolism and weight was not just a calorie counting issue.
Well, the moment that had a great impact on me was actually with a particular patient. And just to give you a bit of context, I am a clinical psychologist. I did my first degree in experimental psychology. Then I did a PhD in psychology. Then I trained as a clinical psychologist. And by the time I had this appointment that I'm going to tell you about, I'd been working in adult mental health as a clinical psychologist for well over 20 years. So this was my day in, day out work was in mental health, and mostly actually to do with psychological trauma, but also across the range of presentations that people come with to psychologists, to clinical psychologists. And so I was in the final session of treatment with a woman that I'll call Megan, who was 40 years old. And Megan had gone on a very low calorie meal replacement plan to lose weight. But wasn't why she was referred. She was referred because, unfortunately for her, this very restrictive plan had triggered bulimia nervosa in her, which was partly because this wouldn't happen for most people. But Megan had suffered with bulimia earlier in her life and recovered, and she'd been fine for a couple of decades. But she came for help to overcome this eating disorder. So we had a course of CBT, cognitive behavioral therapy, for bulimia nervosa, and she made a really, really good recovery. And she was really delighted. And as she left the final session, on her way out of the door, she said, "I wish I could just lose a stone in weight." And she thanked me and she left. And I still remember the room, everything about it. It was so striking to me. that the absurdity of the fact that I'd been able to help somebody overcome really quite a serious eating disorder thanks to psychological understanding of eating disorders and application of treatments. But I knew I would have had no idea how to help her just lose a stone in weight, because at that time I'd been a stone and a half heavier than I wanted. My first pregnancy, which was 15 years before that point. So I just thought, this is really bizarre that all this psychological knowledge and expertise that we have in the profession doesn't seem to, is good at some things, but it doesn't seem to be available in a much more ordinary way. So that's what set me off on a real interest. This is back in 2011. This was when I had that final session with Megan. And it set me off on a path of trying to discover how to apply what we know from psychology to this, what on the surface of it looks like a fairly straightforward issue, which is how to lose a stone or two in weight, and in a way that allows you to keep it off and in a way that doesn't cause other problems. So that was my sliding doors moment.
That's such an interesting conversation with Megan. I mean, like you said, you helped her overcome seemingly like a major barrier, and yet still she was really authentically saying that she wanted to lose weight, and she was still puzzled and frustrated by it.
Yeah.
I think a lot of people can relate to that. Kind of this dichotomy between the emotional piece and then, the dysfunction that weight loss programs might trigger or create, but at the same time, people still want to reach the goals that they were set out to reach. So
yes,
it's a very interesting conversation and a great setup to run our conversation through today. So along with that, it seems like what she was maybe faced with is something that you've talked about in some of your work, which is this appetite pendulum. Can you speak to that and maybe what's going on with what it is and how it plays out?
Sure. So once I was working on how to help people to lose weight and keep it off in a way that was sustainable, this is a very long story short, I became clear that there were three key elements to this. One was about helping people to relearn to tune into their appetite signals, which is what the appetite pendulum is about, which I'll come back to in a moment. The second was that rather than going on really challenging diets, for many people, it might be more helpful to take the approach of start where you are now, look at what's not working in how you're eating and in your relationship with food, and very specifically work on one of those things at a time, so that with each change, you are creating something that is sustainable. And then the third thing is that, as a psychologist, something that is absolutely my bread and butter is that when people try to change patterns of behaving, thinking and feeling, it's hard. So we naturally come up against obstacles. So the first part is about appetite signals. The second part is about stepwise behavior change around eating. And the third part is knowing that you're likely to hit obstacles, or what I call saboteurs, which we can also talk about later. But the appetite pendulum relates to the first of those, that it's about giving people a framework or a scale to rate hunger and fullness in a way that has some sort of intuitive resonance. Because once I started working on this, I discovered that lots of people, quite a few people, had a similar thought to me, that you need a scale, you need some sort of way of rating your level of hunger or fullness. But every single other scale either goes from 0 to 10, where 0 is extremely hungry and 10 is extremely full, or 1 to 10, extremely hungry to extremely full. And to me, that made no intuitive sense whatsoever, because for me, being extremely hungry is not 0 whatever represents extremely hungry needed to be something that reflected its intensity, because being really hungry is an intense feeling. Being extremely full is an intense feeling. So it seemed to me that what would be much more in line with what it feels like to register different levels of hunger and fullness is to put the 0 at the center, so a neutral point, and have plus numbers indicating increasing levels of fullness and minus numbers indicating increasing levels of hunger. So in the end, I played around with how many points to put on this scale, but I ended up with an 11-point scale. So it goes from -5 through 0 up to +5. And I label each of those points so that you can gauge how hungry or full you are at any point. And that's the starting point of relearning the skill of what we call interoception. So your ability to tune in to what is actually happening in your body right now.
Yeah. And I really like that model, and it definitely gives the image of a pendulum because, it's going to tilt in one way or the other usually. So, and I know I want to circle back to why people and how people and what the reason for loss of interoception is, because I think that that's a word that people haven't heard, but when they hear it explained to them, they just get it. It's like a really important concept. So I would love to get into that in just a moment. So a lot of people hearing the word appetite pendulum could think that they're swinging in their appetite or one way or the other, usually in the excessive appetite way due to seemingly non-hunger cues, like emotions. And I hear this a lot with patients of mine, and just, I know it's a major issue is emotional eating. And where does that start for people, and how do we unpack this concept of emotional eating? And it seems like it's such a piece of the puzzle.
It really is. And as I've worked with people over time, I got more and more interested in this. And so I've been working with people specifically on helping them to what I call retrain their appetite, which is basically to return to using those signals. What I really noticed is that of all the particular ways in which eating gets complicated, as in gets diverted away from eating in tune with hunger and fullness signals, is about emotional eating. That it's the most frequently, in my experience, it's the thing that people struggle with most frequently and is one of the most significant blocks to them being able to lose weight if that's the issue, but also to feel more in control around eating and more relaxed around food. So it's a huge issue. And it's a really important question, I think, that you're asking about, like, where does it start and how does it happen? So the elements here, I think, are that infants vary in their appetite, the intensity of their appetite or the voracity of their appetite. And that continues through life. But our experiences as we go through infancy and childhood and adolescence and through adulthood is that we can encounter all sorts of situations and conditions that lead us away from eating in tune with our appetite, emotional eating being one of them. But there are lots of others, like you might lose touch with stopping eating when you're just full if, for instance, you are in a family where finishing what's on your plate is highly valued. And in my experience, most people in the UK and abroad that I've worked with have recent descendants, like parents or grandparents, who themselves experience food shortage. Therefore, the people that bring you up may well have developed a mindset around ensuring that you don't waste food, which of course is hugely important when food is scarce. But when you apply that mentality, that mindset to our new food environment, where there may be a lot of very energy dense food and it may be very plentiful and portion sizes have increased, it's a different issue. So one reason for losing touch with, say, this particular thing of stopping when you're full is that maybe the incentives were all about stopping when your plate was empty, which may or may not be in tune with you being full. It may lead you. So there are lots of, we could think of loads of examples like that, but we can come back to emotional eating too.
Yeah. I mean, it's interesting because a lot of the scenarios I hear is people turn to it when they're lonely, bored, overwhelmed. You know, a classic example is the parent who is taking care of a lot during the day, lots of responsibilities. You could define that in however you want to. Everybody's different as far as their responsibilities are. But at the end of the day, the house is quiet. The kids have gone to sleep. And then it's like this emotional eating process begins. So I hear a lot of that. I don't know if that's a common scenario. There seems to be like a setup.
That chimes with my experience too, of people finding that the time of day that they're most likely to struggle around eating generally actually is in the evenings. But that would include the time when they might find that they turn to food more to deal with emotions, certainly.
Yeah. And, I think it's really interesting not to shame people, and this by no means am making this comment for that, but just as a observation is some folks have gone as far as to have a glucose monitor on in the evening or what have you, and see that time of day is just so vulnerable for the metabolism and from as far as like emotional eating in the evening, going right to bed after that, or going onto the couch, and then just the fact that the glucose is very unstable from that moment on the night. Can you comment to that and how this sort of kind of just to point out sort of the impact of late night eating?
Well, I think as a psychologist, my is mainly around the factors that influence that evening eating. So one of the things that hugely, I think, has an impact in evening eating is that you tend to be tired. Your energy levels tend to be depleted at that point in the day. So whatever else is going on, you may have shed loads of what we call willpower earlier in the day. And very many people who struggle with eating in the evening actually acting during the day using very high levels of focus, energy, and willpower. So it's not what people think it is. I think there's a general feeling that eating that willpower is a sort of personality trait. It's some sort of thing that you've got or you haven't got, and if you haven't got it, then it's not something. It's a weakness or it's a failure in some sense. But that doesn't fit with the research on willpower at all. What is a more helpful way of understanding what happens in the evening, and particularly in relation to the idea of willpower, is that willpower can be seen as a form of energy which gets depleted, partly through tiredness, but it gets depleted by making decisions, and it gets depleted by resisting impulses. So particularly people who have to make a lot of decisions during the course of a day, whether that's in a high-flying job or whether that's looking after a relative or a child or whatever it is, if you're having to make a lot of decisions during the course of the day, or you're working in a setting where you're having to resist impulses, like you're working in a food setting, and you're having to resist eating all the time, then by the evening, that particular form of energy is really depleted. So it's a a feature of what people are then grappling with in the evening.
Yeah. I love that. I've heard of this concept of like a willpower bucket. Like it's just once it's drained, it's hard to overcome the resist, or you're just exhausted from,
Mm.
like you said, all those decisions.
Mm.
Maybe your frontal lobe is ready to call it a day.
Yeah,
Point.
yeah, yeah. And then actually it's replenished, this sort of energy, by sleep. And it also appears to be replenished to a degree by glucose. So that puts you in a bit of a bind that
Hmm.
you might sort of have learned from experience, because a lot of learning takes place below the sort of radar of conscious awareness. And it may be that you have bodily learned that if you eat something, you will have a burst of willpower energy, but that's the very thing that you're trying not to do. So it is a bind.
Yeah, it really is. I mean, I think this concept of doing more versus doing less always puts humans
Mm.
in a bind. Like the end of the day, you finally have some time to yourself. You want to read the book, or you want to watch the program, or you want to knit or do like something that brings you, but you're exhausted. And whereas the body's saying rest, you're trying to get a little more willpower to have like a little bit of something for yourself. And I could see how carbs and sugar can give you that little bit of that willpower back to do more, have another activity. Really clear how you're explaining that. So thank you. So circling back to this concept of interoception and this overlap with this other term that you use in your teachings called alexithymia, which is can kind of go into explaining how those two things overlap, and how listening to your body and explaining what your body's going through is such a difficult process for some.
Yeah, yeah. And the two things too. So interoception is the term for tuning in to signals within your body, physical signals within your body. And so that's very, very relevant to appetite signaling. That is one of the things that's relevant when it comes to understanding emotional eating and how to overcome emotional eating. It's really helpful to be able to enhance your ability to discern what's going on in your body. Like, are you hungry, or are you actually feeling upset, for instance? And as soon as you are then thinking about, well, these other signals, what alexithymia is a term that is used to describe the difficulty that you may have in recognizing and labeling emotional states. So we vary in the ease with which we can identify and label emotional states. Some of us have more difficulty than others. Alexithymia, this difficulty with recognizing and labeling, is one of the risk factors for emotional eating. So being able to learn a greater interoceptive awareness of hunger and fullness is helpful whether or not you engage in emotional eating. But if you do have a significant tendency to turn to food to deal with difficult feelings, then this other aspect of tuning in internally is potentially really important. And we could maybe think more about that. We could talk about that.
I'd like to go into that a little bit more, because I've heard and read and experienced with patients that there are certain conditions that make this difficult in a sense. So like neurodiversity, for example, this is like a common challenge. So I'm just wondering if you could comment on conditions like autism spectrum disorder and ADHD and other neurodiverse conditions, that how you see this in your practice being challenging, and if it's a learnable skill.
That's a really good question. An expert in autism or in ADHD ADHD, but I think that any condition where there is an alteration in one's ability to discern, discriminate, and label what's happening internally is going to be relevant here. And I suspect that whether or not it's learnable, it is probably not one simple answer. I think the extent to which we can get better at identifying learning probably varies across the population. But something that's really maybe quite helpful to know is that you don't necessarily need to be able to label a feeling accurately in order to be able to get more of a handle on it, because you could actually find that you've got an awareness that you get a certain unpleasant feeling in certain situations, like the example you gave of in the evening, somebody maybe being a bit bored, or let's say if they're restless or they've had a bad day and they might be a bit upset. Now, the feelings involved there may be a mixture and they may be quite complex in some ways, but all you have to do is to be able to recognize these feelings surfacing and give them a name, like my evening rubbish feeling, for example, or this antsy feeling, or this brief feeling. It doesn't have to be accurate. The point is that when you label a feeling, something that's really interesting is that when we label an emotion, even if I'm putting brackets, even if the label might not be particularly accurate, but if the process of labeling an experience takes us from being inside the experience, which with an emotion, we think of that as a very midbrain thing of the amygdala and the emotional centers of the brain being predominantly active. So it's like you're in the feeling. And I'm sure we all know the feeling of the experience of being in a feeling that feels overwhelming. It feels like you're inside it and you haven't got any access to doing anything with it. But the moment that you give it a name, even if it's something like this feeling of overwhelm, this overwhelmedness, what happens in your brain is that you've shifted the activity to your frontal lobe, to your prefrontal cortex, so that the logical, rational part of your brain is now engaged. And that gives you a little bit of a handle on what to do. So rather than if you're feeling something and it's the evening, you're feeling rubbish, you may have had a bad day, you may be at a low ebb, and you are on your way to the fridge to get some chocolate or something, or going to the cupboard to get some potato chips, whatever it is, and you can notice what's happening and give it a label, you've then got a little bit of a wedge between the impulse to do that and the action of getting the food and eating it.
Yeah, wonderful. Yeah, I call that getting the frontal lobe online,
Yeah.
and I didn't come up with that. I learned it from somebody, but
Right.
yeah.
It's a good way of thinking about it, though, I think. Yeah.
You could help support the One Thing podcast by visiting our affiliate sponsors. I've teamed up with Healthgevity, which is a company that I learned of over the last several years. I really enjoy what Healthgevity is doing. They have revolutionized the wellness industry by providing the finest quality and most effective nutritional products for ultimate health span. They work in tandem with doctors, patients, and researchers to design real advanced formulas that, frankly, I have not seen done on this level before. Please visit them and see what they have to offer. If you find various products that you're interested and you're looking for a discount, you can enter in the code one thing, all one word, one thing, for a 10% discount. This will not only provide you access to excellent health supplementation products, but also will help support the podcast. Thank you so much, and I appreciate your support. Yeah, and I've read some tools that you teach people, and maybe we could just go into one of those since we're on this topic. So one of the tools I came across that you teach is sort of a pause or a break.
Yeah.
Can you talk about that one? I think that was particularly helpful to learn about.
Yes. Well, there's a lot of uses for the simple pause. One of them that's particularly relevant when it comes to eating an appetite is when you have the impulse to eat, because there can be all sorts of things that might generate an impulse to eat from you've just seen an advert for food, or you've just smelt something walking past a shop, or you've just thought of how nice it was when you ate something the day before, whatever it is. When you find yourself having the impulse to eat, pausing and checking in with what's happening in your body and trying to tune in. This is where the appetite pendulum comes in. Trying to tune in to where you are in the appetite pendulum. So if you are definitely hungry and you've got the impulse to eat, then that would be a sensible thing to do, is to eat something. But if when you tune in, you notice that actually you don't feel at all hungry, and maybe you actually feel a little bit full, then that's your brain telling you to eat. It's not your gut telling you to eat. And the pause, that moment of stopping and trying to just tune in to what's happening in your body rather than what your brain's telling you, it can give you valuable time, even if it's moments, to decide whether to act on that impulse.
Yeah. It makes sense. And I think, it's another strategy of getting the frontal lobe to sort of step out and see what's going on versus being kind of stuck in a trigger or an emotion. So that's, really, really practical and really helpful. And I think people would generally feel like they could do that. Like there's like a empowerment to it, and I think it's a really good message versus just someone focusing on tracking and kind of forcing themselves to fit this number every day. These tools of navigating make a lot more sense than sort of just like a diet plan would have you, where people just feel set up to fail. And, these tools of the process make so much more sense. So given that, I think the concept of when people fall off track or they have these kind of inner challenges, we've called them the saboteur, where if I understand this correctly, we all have different internal dialogues or parts of us that seem to come out and get us off track. Talk about the saboteur and how you kind of figure out your own personal saboteurs process like this.
Sure. So attention to these saboteurs came out again from the process of developing this approach, which I did initially on myself and then started offering it to people and working with people. And what became clear was that there were certain types of what people often the reason I came up with that term really was people kept referring to these things as self-sabotage. And their experience was that they were doing this to themselves, which is not entirely fair, really, because it suggests some sort of deliberate thing going on. But there were 4 particular types of this, let's call it self-sabotage, these saboteurs that kept cropping up. The first one was to do with motivation. So keeping motivated. People often described having a burst of real enthusiasm to start with and motivation, and then that really flagging. So that was one thing that people really commonly talked about. The second we've already mentioned, which is willpower, that they would, however motivated they were, they might find that at the moment that they're faced with doing the thing they intended or doing the old habitual thing, they would really struggle with doing the intentional thing then. So that was more to do with this so-called willpower.
Mhm.
The third type of self-sabotage was around self-belief. So that might be, I don't really believe I can do this, or I failed with diet so many times before that it almost becomes a self-fulfilling prophecy that it's just a waiting game until the whole thing crashes down. And the fourth type of saboteur is actually to do with pressure from other people around eating. So for many people, things that scupper their weight loss attempts aren't all internal. It may be that they live with somebody or frequently eat with somebody who puts pressure on them either to eat more
Mhm.
or to eat less.
Mhm.
And either way, that can lead to eating more, because if somebody's trying to get you to eat less and that's difficult, then it's a fairly natural response for many of us then to rebel against that.
Exactly.
And yeah, it doesn't work. So there's 4 types of saboteurs, and particularly some of them particularly take the form that you asked the question in terms of, which is like having a part of yourself operating against what you intend. And there are different ways of working with these aspects of ourselves.
Yeah.
There's a range of techniques. So it's, if you want to enhance your motivation, there are a number of ways that you can do that, evidence-based ways of doing that from clinical psychology and health psychology that will help to keep motivation going if it starts flagging. So I mentioned these things in my book, How to Retrain Your Appetite, but there's also more about it in my blogs and on my YouTube channel and so on, if people want to know more.
Yeah. I think it's great for people to know that it's a common experience, and there are even platforms or psychological theories like internal family systems that goes into this quite a bit, where, you look at internal saboteurs or that, and learn how to not reject them, but, kind of work with them. I think, the world is embracing holistic approaches more and more, where we're not just trying to stop something in their tracks. We're actually trying to just work with the psychology around this process and, not call it good or bad. It's just a common experience people have.
And it's how we've evolved and how we are, as a result of evolution, how we are pretty hardwired to, I mean, these things all make total sense in the context of evolution, because human beings have evolved to establish patterns that mean that we don't have to reinvent everything every morning when we wake up. So we develop patterns of behavior, which we call habits. We develop patterns of thinking, which we call beliefs. We develop patterns of emotional responding, which you might think of as sort of somebody's temperament or their nature. That is how we are put together. And it is massively helpful and efficient in terms of dealing with day-to-day life, because it means we only really have to use valuable brain space for things that are novel or things that are, so we are, in other words, keeping doing something we've been doing for a long time as a behavioral habit is totally normal. It's not easy to change a habit. It's effortful. It's not easy to change an established belief about something. Again, it's effortful. And the same goes for emotional patterns, but they are changeable to a degree.
Yeah. Well, I'd like to go into so many more topics, but we only have so much time together. So I think one of the things I really wanted to hear your opinion on is, first of all, that some people are turning towards medications more and more for helping with weight loss or excessive appetite, or helping with emotional eating. I've heard the term food noise disruption. This is not only being embraced by lots of parts of our society, but also there's lots of research and medical and pharma behind it. So I just like to hear how this has influenced your practice and where they fit into your behavioral model?
Well, when I started this work, treatment on offer was actually bariatric surgery, which is still the treatment of choice for people. And it's the treatment with the highest success rate for people living with obesity. And since then, since I started doing this work, the GLP-1 agonists have been approved for use with people living with obesity. And they are having, and they have had, a phenomenal impact on people. The thing that strikes me is that it's important that if you're considering medication, you do that by consulting somebody suitably qualified to prescribe it, that you don't do it without being assessed and prescribed by a qualified doctor, that it's more likely that you will benefit from these medications if you are experiencing very high levels of what you call food noise, which I think my way of thinking about it is it's appetite signaling. That's the biological process that generates the cognitive experience of food noise. So the thoughts and the images of food, and the amount of food noise that any one of us is experiencing varies between individuals, and it's closely linked with our appetite signaling. And we all vary in the way that appetite signaling works. And some of us have much more drive to eat, biological drive to eat, and much reduced biological drive to stop eating. And that's all to do with metabolism and metabolic signaling. And I think the medications have had a massive impact and will continue to have. And I would say that my approach is like everyone who works in this field, who's a psychologist or the professional working with eating behaviors and eating patterns, including emotional eating, that this is sort of complementary. My approach certainly does not, I would say, it's not at odds with, lots of people that I work with have been taking medications more recently.
Yeah. So I think the role's definitely embracing like a biopsychosocial model to all of this and realizing that the mixture may lead to better outcomes for people. And yeah, I think some of the programs I've seen where people do take GLP-1 agonists, but at the same time, they work on their emotional relationship with their food and their body. And they're working on the nutrition component and process, not exclusive. I've seen some of those models pop up and they're very promising. Well, this has been fabulous. I think just to shed light on something that I didn't get to talk about that I think deserves some mention is, and maybe this is a topic for another episode, is people who are not overeating and are still having struggles with their weight. I think that's like a significant amount of the population where they're struggling losing weight and they're not having these behaviors or calorie excess or what have you. So it's something I'd love to get into at some point. This has been an amazing rundown of very important information, and I really appreciate you being here. I'd love to conclude with like a take-home message and then talk about how people can work with you. Anything you'd like to mention as far as how they can learn from you further?
Well, I think the simplest take home, would be maybe to, and there's a tool that you can use on my website that's downloadable for free, which I call the Unhelpful Eating Habits Checklist, which is a collection of the most commonly reported specific eating habits that have got in the way of people losing weight. And if you download that, what is a single sheet, and you just tick the things that apply to you, and they include things like emotional eating, they include things like eating in response to cravings, eating beyond the point of being full, and so on. But if you look at that list and tick the things that are relevant to you, then you've got a little bit of a sort of, if you like, a map or a plan of the things which you could address one step at a time and totally it's really different from going on a diet because you've been very specific about particular things that you want to change, and you're just putting the available energy and mental bandwidth you've got to making one step change at a time. And the information about how my approach can help you and ways in which you might benefit is all on my website, which is the appetitedoctor.co.uk. So maybe you could put that on the
I will
show
definitely.
notes.
Yes,
Great.
absolutely. Great.
Thanks.
And I'll also put a link to your book and just more information we can provide for people. So
Thank you.
yeah, so thanks again for being here. And if there's anything parting words you'd like to share, go ahead. Otherwise, thank you so much.
Well, my parting words are that it's such an interesting topic, and I feel we skimmed the surface. So interesting talking about this stuff. I never tire of talking about this stuff, but there is so much to it. There's so much. The thing that really astonished me, thanks to Megan and starting to really find out about the psychology of eating and appetite, I discovered an entire literature, an entire branch of psychology I had no idea existed, which studies eating behavior and all of the influences on it. And that's what ever since I've been trying to share that stuff with people. So that's what I do in my blog, on my YouTube channel, and in my book, and so on. And there's loads of information that I hope people will benefit from that's just there for free on those channels.
Excellent. Well, thank you so much.
Thanks for having me, Adam.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.